The PSA Excellence Awards acknowledge the achievers of the pharmacy profession. In particular, those involved in innovative practice, those striving to raise practice standards, and those who, through their professionalism, provide a model of practice for others to emulate.
I think I chose pharmacy because of its service element, of its helping people.
My father wanted me to be a teacher. My mother wanted me to be a shorthand typist, as she was. And when I worked for the Pharmaceutical Society, I reflected. There I was, sitting in an office, behind a computer, typing, and then going down and giving lectures. So I think I satisfied both of their needs.
Politics is always politics. The objectives have changed. I had a lot to do, and indeed John Howard had arranged for me to chair the COAG review into the operation of pharmacy. And in that review, I made the recommendation that pharmacy should be owned and operated by pharmacists. And that, I think, has been a great service to the profession that I've been able to render, and also it's a great service then that the profession can render to the community.
What I enjoy most about community pharmacy is the relationships that we can develop with the customers. They're much more open when they know you, and then you find out more information about them, so it helps to make better decisions and it helps you to work together to get them the best health outcomes.
The things that I find now rewarding is getting results, good results for the community, for pharmacy, and along the line being able to have an interesting and varied career.
I think I'm probably one of the ones that hasn't learnt to say no too often. I tend to say yes because I see a project as challenging, exciting and something new to do. But certainly I think a lot of consultant pharmacists are starting to do this, and also community pharmacists are getting out of their pharmacies and going and speaking to community groups, doing different things, and I think that's the direction that we've got to go to, and that is specialty pharmacy, specialising in whatever interests them, whether it be wound management, whether it be sleep apnea, but it is working with a team approach to the other health professionals in the area.
I'm very excited about what pharmacy can achieve. I think that if we all work together, then we have an amazing opportunity to provide for the community and beyond that as well, and also to be a support to other healthcare professionals.
I was pleased to see, and in fact I encouraged pharmacy people to go and have an interaction as undergraduates with medical undergraduates at Sydney, and that's happening to a greater degree, I understand, and should happen. And you want to be able to encourage people, pharmacists, to have and be able to establish good contacts with their medical local practitioners.
I think one of my big advantages has been working for the divisions of general practice, getting to know how doctors think, working closely with them, recognising their needs and speaking their language. We can actually work very closely with them. The number of pharmacists that work very closely with their local doctors, and that's fantastic.
There is definitely a need for pharmacists to be out there promoting what pharmacy does. So to move away from just supplying medicines and being the pharmacist at the back of the pharmacy.
A guide for the future is for pharmacy changing its role as it is, knowing that it's changing and being able to keep up with the demands made on it. And the greater demands that it's got now is one of information and education.
I would really like to see pharmacists recognised as health professionals and not just people who are in Main Street. Certainly our hospital pharmacists are, and our community pharmacists need to be professional. They need to be evidence-based and to be accepted. They need to show value of what they're doing.
We want to be part of the whole healthcare solution and the healthcare team as well, working collaboratively with doctors and nurses and other healthcare professionals. Young pharmacists definitely should be out there being enthusiastic and showing what pharmacy has to offer.
I just love helping other pharmacists fulfil their potential and going around to the country visits which pharmaceutical societies send me to, and I've done for a number of years, and having friends, colleagues there who welcome me, thanking me for coming and say, that's really helpful, I can use that in my pharmacy tomorrow. That's great.
Well, I thought my time of acknowledgement had passed, and I was so thrilled to think that that was the view of the society and that committee, and I'm very honoured and humbled.
I have been amazed by what young pharmacists have achieved, and always just imagine that I could be one of those people that received that award. Not that I actually expected that would happen. These people have been so inspirational, and that's hugely motivating for me to be a better pharmacist.